Hi, I'm Matilda and I'm a certified clinical aromatherapist. I'm also a trainer of internationally accredited aromatherapy courses. So if you would like to pursue aromatherapy professionally or would like to deepen your knowledge in this area, do check out my link in the description down below to find out more information on the courses that I teach. This channel is set up to empower women in health and wealth. So if you are interested in the topics that I am sharing, do subscribe to this channel and hit the notification bell so that you will be notified of all future videos. Today, I'm going to share with you what are some of the signs of low vitamin D levels, the causes, and why it's important to boost your vitamin D levels and how you can do that naturally. Do you know that between 40% and 80% or more of adults in the US is believed to have a vitamin D deficiency? That's why vitamin D is now one of the most recommended supplements by health practitioners for those who suffer from and to prevent vitamin D deficiency symptoms. While many adults are somewhat deficient in vitamin D, people with darker skin and people who live in northern regions of the world where there is less sun exposure throughout the year, and those who are overweight have an even greater chance of experiencing vitamin D deficiency symptoms. Fortunately, you can naturally increase your vitamin D levels by spending time in the sun, and eating vitamin D rich foods also helps improve your vitamin D levels. Do watch on to understand just how much time you need in the sun and what foods will help you avoid vitamin D deficiency symptoms. If you like this video that you're watching, I would appreciate it greatly if you could smash the like button and share it with your friends. So what is vitamin D exactly and why do we need it? Vitamin D is a fat-soluble vitamin that's stored in the liver and fatty tissues. In fact, many believe that vitamin D should be classified as a hormone, as it is different from other vitamins because the body is able to make most of it on its own with sufficient exposure to sunlight. And the active form in our body called calcitriol has similarities to other hormones like estrogen, cortisol, and testosterone. And why do we need vitamin D? Here are some of the benefits associated with vitamin D. Vitamin D helps support bone health by promoting calcium absorption into the bones. Vitamin D also helps boost our immunity by helping to prevent prolonged or excessive inflammatory responses. And having sufficient levels of vitamin D seem to help protect against some infections and viruses. Vitamin D may also protect against the development of autoimmune conditions. Vitamin D also works with calcium to regulate insulin secretion that helps maintain normal blood sugar levels. Vitamin D helps uplift our moods, keep our energy levels up, and may help prevent depression and mood disorders as well. As some of you may already know, vitamin D is also known as a sunshine vitamin, as it is believed that up to 90% to 95% of most people's vitamin D comes from casual sunlight exposure. When you sit in the sun unexposed for roughly 10 minutes, you are likely to absorb about 10,000 units of natural vitamin D. However, keep in mind that this amount differs from person to person depending on skin tone. But because most of us are indoors nowadays, most of us remain vitamin D deficient. I was actually very surprised that I tested very deficient in vitamin D years ago, despite living in sunny Singapore and I loved swimming and suntanning when I was younger. I tested for vitamin D because I was suffering from PCOS back then, and I read that vitamin D deficiency is one of the symptoms. Hence, we never know how deficient we are in vitamin D until we actually do a blood test for it, and there are various causes for low vitamin D levels. Also, the darker our skin color, the more melanin we have in our body, and we will require even more sunlight to produce vitamin D. While we may also obtain vitamin D from some food sources, we don't usually get sufficient vitamin D from the food consumption, as we need to take more than 15 eggs or 300 mushrooms to have our daily requirement of vitamin D. And for those of us who are already deficient in vitamin D or do not expose ourselves enough to sunlight or darker in skin tone, we will need to take even more than this. Vitamin D supplements come in two forms, D2 and D3. D3 is closest to what sunlight naturally produces in humans when the skin works to convert UV light. Hence, vitamin D3 is therefore the more active form and believed to be more bioavailable than D2. On a more serious note, public health experts tell us that it can be, and it's now linked with a growing number of health conditions such as cancer, diabetes, hormonal imbalances, and mood-related problems. So what are some of the symptoms of low vitamin D levels? According to several scientific studies and reviews, vitamin D deficiency symptoms can include a weak immune system. So if you are often getting sick and infected easily by viruses and bacteria, you may wish to know that one of vitamin D's most important roles is keeping your immune system strong so you're able to fight off viruses and bacteria that cause illness. It directly interacts with the cells that are responsible for fighting infection. Another symptom of vitamin D deficiency is fatigue and tiredness. Feeling tired can have many causes, and vitamin D deficiency may be one of them. Unfortunately, it's often overlooked as a potential cause. And as someone who has been deficient in vitamin D before, I can tell you that there was a period of my life where I constantly feel chronic fatigue and I'm always tired. Even if I sleep 10 hours a day, I will still wake up feeling tired. And when I started supplementing myself with vitamin D, I felt a lot more alert and awake. Another symptom will be chronic bone and back pain. Vitamin D actually improves absorption of calcium. So for those of you who have weak bones and you're taking calcium supplements, you also need to take vitamin D to increase the absorption of calcium. This also leads us to the next symptom, which is bone loss or osteoporosis. And as explained earlier, vitamin D plays a crucial role in calcium absorption and bone metabolism. So that's why for those of you who suffer from osteoporosis, you may also want to supplement more with vitamin D. Another symptom will be depression and moodiness. If you're constantly feeling depressed and moody, that may also be a sign of vitamin D deficiency. Researchers have linked vitamin D deficiency to depression, particularly in older adults. Another symptom will be impaired wound healing. Slow healing of wounds after surgery or injury may be a sign that your vitamin D levels are too low. It's also been suggested that vitamin D's role in controlling inflammation and fighting infection is important for proper healing. Results from a study suggest that vitamin D increases the production of compounds that are important for forming new skin. And for those of you who have concerns about hair loss, one study shows that in people with alopecia areata, which is a kind of autoimmune disease characterized by severe hair loss from the head and other parts of the body, tend to have lower vitamin D blood levels and deemed to be associated with a more severe hair loss. In addition, autoimmune diseases also appear to be one of the symptoms of low vitamin D levels, and some of these autoimmune diseases include diabetes, multiple sclerosis, lupus, rheumatoid arthritis, as well as autoimmune thyroid disease. Vitamin D also plays a role in terms of cancer development as well as reducing pain in existing cancer patients. Vitamin D deficiency symptoms have been correlated with increased risk for cancer development, especially breast, colon, and prostate cancers. The anti-inflammatory properties of vitamin D may also be able to assist with reducing pain levels in cancer patients when their levels of vitamin D are increased to correct their deficiencies. Vitamin D has also shown to play a crucial role in cognitive disorders, in brain development and function, as well as to maintain a healthy nervous system. And patients with depression, anxiety disorders, schizophrenia, dementia, Parkinson's, Alzheimer's, and older adults with cognitive decline are commonly found to suffer from vitamin D deficiency. And as mentioned earlier from my own personal experience, hormonal imbalances is also one of the symptoms deriving from low levels of vitamin D. Low levels of vitamin D may interfere with proper testosterone and estrogen production, leading to imbalances that can result in many unwanted symptoms. As many of you may already know, I used to suffer from PCOS, which is a kind of endocrine disorder, and one of the symptoms is vitamin D deficiency. When I did a blood test for vitamin D, I am indeed very deficient despite living in sunny Singapore and always swimming and suntanning. So what are some of the common causes for vitamin D deficiency? First and foremost, that will be the lack of sun. While years ago, people spent more time outdoors, walking to do errands, and even working outside, today we see a different situation, especially with the pandemic, where many of us stay indoors, choosing for food and grocery deliveries without having to go outdoors. Even children spend many more hours indoors, watching television, playing games, surfing the internet. Similarly, most adults work indoors, exercise in gyms or at home, and spend our free time at home cooking and baking where we are sheltered from the sun. By being sheltered indoors most of the time, it's not surprising we don't get enough of the sunshine vitamin, and that vitamin D deficiency affects over 1 billion people worldwide. And as mentioned earlier, those of us with darker skin tone will require even more sunlight to produce vitamin D. A study done in 2010 showed that more than 90% of people with darker skin pigments, including African Americans, Hispanics, and Asians, living in the United States now suffer from vitamin D deficiency, compared to 3/4 of the white population being deficient in vitamin D. It has also been shown that as we age, our body's ability to synthesize vitamin D from exposure to the sun starts decreasing to as much as 25% reduced production over the age of 70. Being obese or overweight may also increase your risk for vitamin D deficiency. A recent study showed that obese subjects had 35% higher rates of vitamin D deficiency and 24% higher rates compared with overweight subjects. For some of you with existing health conditions, you may also wish to know that research shows that certain health conditions such as abdominal obesity, diabetes, insulin resistance, and high blood pressure may also increase your risk of vitamin D deficiency. So now that we know the signs of vitamin D deficiency and why vitamin D is important, how do we deal with it naturally? How can we increase our vitamin D levels? While some foods provide vitamin D, exposure to sunlight is still the very best way to prevent vitamin D deficiency symptoms. However, research shows that eating foods that are rich in vitamin D and calcium also helps you acquire more. So try adding these good quality natural sources into your diet. Generally, here's how to increase your levels naturally. Top on the list will of course be sunlight exposure. Aim to spend 10 to 20 minutes of unexposed time to the sun daily. That will give you between 1,000 and 10,000 IUs of vitamin D. The range is so wide as it depends on the time of year, how far from the equator you live, and how much skin is actually exposed. If you have darker skin or live further north in the northern hemisphere, you need about an hour of sun in the summer to get about 1,000 IUs of vitamin D, and even more if it's in the winter. And to obtain the bare minimum of 600 IUs of vitamin D, you will have to eat 15 eggs, 300 cups of mushrooms, 3.5 tins of sardines or 26 sardines, 1.1 pounds or half a kg of caviar, or 6 cups of fortified milk. So that's a lot to eat just for 600 IUs of vitamin D. And 600 IUs is just the bare minimum. Most of us should actually take about 2,000 IUs a day. And if you are already deficient or you're prone to being deficient in vitamin D, I would recommend even 5,000 IUs of vitamin D a day. And contrary to what many people think, regular pasteurized milk and dairy products do not naturally contain much vitamin D at all. Synthetic vitamin D added to foods is believed to be much less effective than naturally occurring vitamin D and can also potentially block natural vitamin D's effects. Raw milk, on the other hand, is believed to contain a small amount of vitamin D naturally, which is found in its fat and not destroyed during pasteurization. In any case, this is way too little compared to our daily requirement of vitamin D. Because of our tendency to stay away from the sun nowadays and difficulty in obtaining sufficient vitamin D from food sources, vitamin D deficiency treatment usually involves supplementing with this vitamin. So how much vitamin D should we supplement with? Because vitamin D deficiency symptoms are a growing concern worldwide, especially in Western developed nations, authorities recently doubled the recommended daily intake of vitamin D. The recommended daily allowance for vitamin D, according to the USDA, is 600 IU per day for adults. However, getting more around 5,000 IU per day may be more effective, especially since for more people there is little risk in over-supplementing with vitamin D, and for adults of age above 19 years old, the Endocrine Society recommends 1,500 to 2,000 IUs per day. Keep in mind that this is a general recommendation, and there is no way to know the exact amount that's best for you without a blood test. You may need a higher or lower amount and should speak to your doctor, as the only way to know if you are deficient is to have your doctor perform a test called a 25-hydroxy vitamin D test. For those of you who may be confused between the measurement units IU and mcg, because some supplements show the dosage as mcg, every 1,000 IUs is equivalent to 25 mcg. Luckily for most people, their skin is able to regulate vitamin D conversion according to heat and other factors. It can store pre-vitamin D for future use and destroy amounts above and beyond what is safe. Therefore, deficiency is usually a much bigger concern than consuming too much vitamin D. Also, keep in mind that because vitamin D is a fat-soluble vitamin, I would recommend that you consume vitamin D together with some essential fats like coconut oil, omega-3 fatty acids, nuts. If you like what I have just shared, do smash the like button, subscribe to this channel, and hit the notification bell so that you will be notified of all future videos. That's all I have to share today. I really appreciate you being here today. So if you like this video, do smash the like button and share it with your friends. Have a good day and a great week ahead, and don't forget to check out my other videos.